Millions of people have gallstones and they have no idea what to do about it. In the next few minutes, I'm going to reveal 3 things that you need to know if you have gallstones. Gallstones are tiny hard rocks that form in the gallbladder. Gallstones form when substances in the bile, such as cholesterol and bilirubin, harden into stone-like structures. They can slow or prevent bile from reaching the small intestine, leading to complications. If left untreated, gallstones can cause inflammation of the gallbladder, known as cholecystitis. Cholecystitis can lead to severe pain, fever, and even infection. In some cases, gallstones can obstruct the common bile duct, causing jaundice, characterized by yellowing of the skin and eyes. This happens when the flow of bile is disrupted, leading to a buildup of bilirubin in the bloodstream. If not promptly addressed, gallstones can lead to inflammation of the pancreas, called pancreatitis. Gallstones can cause belly pain, itchy skin, and nausea. Sometimes gallstones can cause shoulder pain, usually the right shoulder, but it can be the left. Pain can be mild or really bad, and it might get worse when you eat food or even if you don't eat food. Gallbladder removal is often offered, but this can cause other problems. This reminds me of a patient who I will call Jane Doe. Jane lived a busy life and sometimes neglected her health, focusing on taking care of others and prioritizing work over her own well-being. One day, Jane started experiencing sharp pains in her belly. She brushed it off as indigestion, thinking it would pass. However, the pain persisted and worsened over time. The pain became so intense that Jane could hardly eat without feeling nauseous. And she was constantly fatigued. Jane continued to ignore her symptoms, hoping they would go away. As weeks turned into months, Jane developed itchy skin and constipation alternating with diarrhea. Even then, Jane chose not to seek help, fearing the inconvenience and potential costs of treatment. Eventually, the pain became unbearable and Jane rushed to the emergency room. After numerous tests, doctors diagnosed her with gallstones and cholecystitis, which is a severe inflammation of the gallbladder. Her gallbladder was removed, the intense pain stopped, and she thought she was all better. But within weeks, she developed heartburn and a return of belly pain and constipation alternating with diarrhea. Doing her own research, she found out that the gallbladder performs important functions, and removal had altered her digestive processes. Now, people without a gallbladder can still be helped, but it's a lot easier to help those that still have their gallbladder. If you have gallstones and want to take action before gallbladder removal becomes necessary, then stay tuned and I will reveal 3 things that can help. Each one is important, but the third one is the most important, so I recommend that you watch this video to the end. My name is Dr. Barrett. I'm a chiropractor, nutritionist, and herbalist. I'm certified in acupoint physical medicine and pet acupressure therapy. I've helped thousands of people live better naturally, and I want to help you too. There are 3 components to all healing processes. 1, stop doing harm. 2, reduce stress in the body. And 3, start the healing process. The first thing that I recommend for people with gallstones is to stop doing liver and gallbladder flushes. While liver and gallbladder flushes sometimes help, they can also force a stone into the bile duct where it can get stuck, causing severe pain. The second thing that I recommend is to take stress off your liver and gallbladder by having a daily serving of Bile's broth. Bile's broth is a combination of vegetables that help reduce inflammation and promote healing of the liver and gallbladder. To make Bile's broth, steam until soft 4 zucchini, 1 pound of string beans, 2 stalks of celery, and 2 bunches of parsley with the stems removed. Then, after maybe 5 to 10 minutes of steaming, take all the vegetables, put them in a blender, and blend until it's a thick soup. Have a cup or 2 every day. You can store the remainder in the refrigerator and it will stay fresh for a few days. The third thing that I recommend for anyone who has gallstones is to start the healing process. To make this easy, I've created a program that I call Healthy Gallbladder Mastery. I put my video here. Check it out.